Good morning, everyone, and welcome to Certipay's Coffee Chat. We're so excited to have you here. I have my Americano made with the Dharma Espresso from Temple in California. Thank you, Temple. I love your coffee. And they did not pay me to say that. So Certipay is so excited to be doing these coffee breaks for you. We know that we're providing some great information. We also ask if there's something you want to hear or a topic that you need more information on, let us know and we'll do one of our coffee breaks on that topic. So for today, oh, don't forget to mute yourselves, guys. So for today, we're going to be talking about OSHA new rules post-COVID. There was an update on May 26th, so we wanted to go through all of the OSHA guidelines. And we are so excited to have Claire Vasquez-Peace on our team, who is a certified OSHA expert. So with that, let me turn over to Claire. And remember, you've got the whole Certipay team on your side. So take it away, Claire.
Thanks, Rachel. And she is so right. We started these coffee talks every what number is this one?
This is 8.
8, and it's been a success. It's a way for us to stay in touch with you. We may not be on site during this time, but we are at heart with you. So this is important because OSHA and the safety is one of my pet peeves, and it's important that everyone knows how important it is. And before I always go into, to conduct an OSHA audit, I always have my hat, my mask, and my gloves. And I'll tell you, every time I go out and do an OSHA audit, I do not leave these things behind, because at the end of the day, I don't know what I'm walking into, and I do not want to be either contaminated or something fall in my eyes, or I inhale something, a chemical. So hold on for a sec. Hold on. So I'm always prepared for that. And I want you to be prepared for this as well, too, because this is important. These are changes. OSHA's not new. I hope you all know that. It's just not a new thing. It's been around since 1973. It's the Occupational Safety and Health Administration. But I want you to start paying attention to some of these things. The general duty clause. This is something that every employer, every industry, you are truly not exempt from not creating a safe workplace. It is your responsibility to create a safe workplace free of hazards that can cause death or even physical harm. And as we're going into this COVID stage now, you understand how much more I become, concerned, when I'm talking to you or I'm having these Zoom meetings and the entire conference room is all together and no one's wearing a mask. Those things do concern me. So COVID is not going to go away, not yet, not until at least they find, we know that they find a vaccine, but I want you to be prepared to what's coming ahead. Companies with 10 or fewer employees do not need to keep OSHA injury logs. So I don't believe that anyone's exempt on here, and those employers are covered by the OSHA Act. They are all covered. That results in a fatality or hospitalization of 3 or more employees. And if you want to know if you're exempt or not, just go to the website. I'm not making this up. Just go to the website and you'll know if you're exempt or not. The golf and country clubs have a different code, as well as manufacturing, distribution, under the general industry rules. They have different codes, but you're not exempt. Every employee counts in your workplace, everyone. Your full-timers, your part-timers, your seasonal employees, and your temporary employees. And what that means that anyone that has an injury or illness that's work-related, it has to be logged into your OSHA log. And for example, with the temporaries, that's a joint responsibility that OSHA sets. And here's what I advise everyone to do. If you're hiring anyone from an agency or from a temporary agency or from a subcontractor, that they follow your same safety CDC guidelines, the same ones, and they sign off on it. because at the end of the day, we want to mitigate those potential lawsuits, workers' comp claims, liability claims that may come to you because your temporary employee or your seasonal employee did not follow the same direction. And in all languages, whatever language that employee speaks, make sure you do it. So the new record-keeping guidance that just went into effect, effective May 26th, coincidentally, I had just completed another OSHA or another safety webinar or Zoom meeting, not about a week before that, and all of a sudden this was in the works. But this is what it says. This is what OSHA says. If it's recordable illness, if it's a confirmed case of COVID. Well, how do you prove it's a confirmed case of COVID, right? Say, for example, that you have an employee that was COVID, and most of my calls now are because of that. An employee has COVID, and you did not in any way secure the workplace. You did not follow the CDC guidelines for disinfecting. You did not follow any of the safety guidelines. You did not remove the employees from that site, and then someone else catches it. Well, this is becoming a very scary thing because prior to May 26th, OSHA says the only things that are recordable are the industries that are in the healthcare, first responders, and the medical field. Well, guess what? May 26th, it said everyone is responsible. Everyone's responsible now to record if they can prove, and always remember this, the burden of proof goes back to the employee. How do you prove that you implemented all your safety guidelines, right? Most important that. Then the case is work-related exposure, like we said. All of that is a requirement. So what you need to know is you have to implement your safe practices. You have to implement those safety guidelines. You have to have your employees wear their mask if they're going to be in close proximity. If you know that an employee has COVID, do not let them come to work. If they're starting to feel sick, do not let them come to work. We went through all of this last time, but I just want to reiterate on that. Most important is they are recordable if it follows any of these three guidelines. Does everyone understand that? Because that's again, if you have a COVID employee and someone else catches it, well, guess what? It might even become a workers' comp claim. So let's try to reduce these claims from happening, because it's only going to create fear and an unsafe workplace. Let's put your safety hard hat on. Get that safety hard hat on and start thinking safety. Safety is probably the most important thing we're going through in this stage of our life. So that's one of the criteria they're saying. So how do you record this, right? So we're going into how do you record all this? Well, the criteria under OSHA says if it's death, right? Someone's fatality, God forbid, God forbid someone's up on a ventilator, right? Loss of consciousness, days away from work, job transfer, light activity, restricted work, any of those criteria are recordable. Anything beyond first aid. And if you need to know what's beyond first aid, just let us know and we'll send you that beyond first aid checklist, because it is, a cut in the finger, you still record it. Believe it or not, you still record that little cut on the finger. What it doesn't become, it's recordable, because I'll use that as an example, because it was just a cut, right? But what if that employee was diabetic and he ended up getting an infection and he ended up having to go to the hospital? Well, guess what? That becomes recordable. So those practices have to be put in place. The PPEs are so critical right now, more important than anything else. The face mask, the glasses, for safety glasses, especially if they're working out in golf, maintenance, out in manufacturing, anything in distribution, anything that they're doing, you should be providing these PPEs, personal protective equipment, to your employees. Because if someone's out there, it's so easy. These are cheap. They're about $1, and you can buy them by the bulk. These are cheap too. These are not N95. These are just regular masks. But anyone that's out there at this time, like I said, the PPE is important. But don't just give it to them. because I've seen so many times people wearing them backwards. Train them. Make sure that the employees whom you are providing the personal protective equipment are all trained in their language if they do not speak English. If you hire them, you earn them. So make sure that you are providing the training in that language, and that you're providing the training how to maintain it and how to clean it and all those necessary things, right? The maintenance and your safety posters. There's so many great safety posters out there. You can just go to the OSHA website and order them. Don't buy something that's off the off of some site. I walked into a restaurant, no lie, and I looked up and they had the little hand sanitizer on the bottom on the wall, and they had this poster and it had hand sanitizer, and it was misspelled. And I asked the owner, I said, "Where did you get that poster from?" And she says, "Oh, I pulled it off some website." I said, "Well, it's misspelled. Do you know that?" And she looked at me, she goes, "I didn't even realize that." Hand sanitizing was spelled incorrectly. So think about that. Just go to the reliable source, your CDC, your OSHA sites. Those are good, reliable sources. So make sure, again, that if you're providing personal protective equipment, everyone is wearing it. There's no exemption to that rule, and everyone is trained, and everyone has know how to maintain it and clean it. And if they break, well, get a new one. So those, again, reminder, PPEs are important. What cases need to be recorded? This is something that I always look at, and it gets very, very, funny with some of my clients. Well, what's recordable? What needs to be recorded on the form? Injury or illness, anything that's work-related, anything that meets certain criteria, such as a near miss. If you're familiar with a near miss, and I'll tell you, OSHA loves to see near misses. And the reason is because a near miss is, say, for example, I'm walking into your distribution center, and there's pallets there in the way, and I almost fell over them. Well, that's a near miss, because now I'm going to instruct the plant manager to say, hey, there's some pallets in the way. That could be a trip and fall, right? So that's a way of a near miss. You still record it. It's not OSHA recordable, but you log it in your OSHA log. The same thing, I'll go back to that cut in the finger. I have a cut in my finger. We're going to get the employee to fill out their incident forms properly in whatever language, and then you can actually, translate it if it needs to. And then that cut is nothing right now, but again, once it becomes recordable, it's because that person was hospitalized, or they missed time, or, God forbid, they end up losing their finger because they end up getting such a bad infection. And take those little things serious. A lot of the claims are really just from cuts and falls. A lot of these workers' comp claims that no one took serious. Take those claims serious. If someone, again, going back to a cut, someone gets cut, make sure that they wash their hands. Make sure that they put disinfect, not bleach on them, but, peroxide or something like that, alcohol to clean the wound so it's not getting infected. So that when they're going back into the maintenance department, they're not exposing that open wound to potential infections, because that's where these claims come from. All of these claims come from not taking care of the injury at the moment. So remember that anything that needs to be recorded on this form, it's just recording it, and then I'm going to show you what's recordable at the end or not. So the forms that need to be completed, OSHA says we have 3 forms, right? Everyone knows those forms, and we see them all the time. You have your 300, your 301, and your 300A. So each one plays a role in it, every single one. And then you have to be really specific when you're filling these things out. Don't just put a lot of lengthy information. OSHA, when you come in and OSHA says, hey guys, I'm going to put my OSHA hat, I'm going to audit you. They want to see, the first thing they're going to ask you is for the OSHA logs, and they look for clarity. They look for misspelled words, believe it or not. If it's the left finger, cut left finger, that is the actual situation was cut, and the body part is the left finger. Then what was the employee doing during that time? Well, he was cutting, he was in the kitchen cutting vegetables, right? In the kitchen, it happened in the kitchen, cutting vegetables. Be extremely specific. Don't write a lot of nonsense. It's irrelevant because that information is what's going to be exported into those OSHA logs when you fill that in, right? And that's important that if you do misspell it, if you have too much information, actually you can even have a violation, and I've seen that. So the 300 logs, your OSHA logs, your employee, when they fill out their incident report, you're taking that information and taking it into your into the OSHA log. And then your summary log, at the end of the summary log, your 308, it's what you pull out on February 1st. But make sure before you do that, before, within the year, you're updating those forms. Every time an injury occurs, you need to update them. Because say someone's been out on leave for, I don't know, for 2 weeks, well, make sure you go back to that OSHA log and put 2 weeks. The maximum amount of days that OSHA allows you to do is 180 days. So anything beyond that, you can stop updating it. But you only update it within that calendar year. Okay? So that's important about these OSHA. You have 3 you have to conform with. If you're within that, and I think someone said if they're 11, I believe so, anything 10 and over, you're required. Okay? So the next thing is how, like I said, what does it look like? Well, this is what the 301 looks like, right? This is really simple. The employee's name, their address, date of birth, date of hire, what they were. Again, if it becomes a workers' comp claim, you have a case number in that log, the date of the injury, the employee began work, what happened? That's what I was trying to explain. What was the employee doing? Okay, you're specific. Again, what happened? They fell or they tripped. Again, being specific. The next log, the next OSHA form is the next one, is the summary. This is the summary A, where all this information for the whole year is captured, the total amount of days away from work. This is where all your forms are being captured, and it gets posted and signed by your GM or by the controller, whomever it is. It is not an employee that signs this. An employee does not sign this. Now, CertiPay, what we do, we gather all that information and we complete it for you. You don't have to go in there and try to figure out what was the average number of employees or what was the total number of hours. That's already done. If you're a payroll client of ours, that's already done for you. All your SIC numbers, everything's in there. And how to find that if you're using our system, it's really easy because we want to make it as easy as possible for you. We don't want you to manually go into an OSHA log and try to figure it out. Everything's in there. You just automatically go into your HR section, you key in your injury report, injuries, and then that's where the employee's profile is going to come up. And remember how specific I said, to be real specific, the date it occurred, what type of injury was it, a fall, a cut, a bruise, anything like that. Very specific. And we have every section's in there that you can drop down. If it becomes a workers' comp claim, put it in there and be specific. And then that information comes over into the employee profile. And what I love about this is it's reducing the admin work from you doing it manually. Because remember, when the employee fills out the incident report, this is exactly what you're capturing, this information. The case number, and the case number is, for example, if you decide to have case numbers. I don't really use case numbers unless it's a police report, an automobile accident, something that had a case. But it has to be accurate. The time the employee started, the work time it started, when it was filed, when it was closed. And when you go back to the date closed, look at your lost runs. Pull your monthly lost runs. How many times do you pull your lost runs? Sometimes we forget to pull those lost runs. Pull them monthly. Make sure that it's updated. And many times when I audit, when I go and do an audit, safety audit, I pull the lost runs. I compare it to your OSHA logs, and they're never up to date. And you have open claims. And what does it happen with those open claims? It means that you have a lot of money out the door, and it hasn't been closed. So go back, set it as a reminder monthly. just to check my loss runs, make sure that they're up to date, and make sure that it is, in similar to your OSHA logs too, that the information there is correct as well too, because a lot of times I find that it's not correct, and then we have to go back to the broker to make sure that, or in the carrier to make sure that claim has been closed. So that's where I see the date closed. If the employee returned to work, what day they returned to work, and how many days were they gone. And if they continuously they're out, let's say they're going to be out for 2 months, then you're going back there. That's why I like the reminder once a month, just to update the days away from work, because all this information is going to transfer and export over to those OSHA logs. We are going to make it so simple for you. You do not have to create the wheel. You don't have to pull the OSHA logs off the website. We have it there for you to simplify your life. The more information you have in here, the more safe conscious you will become. Then you see at the little bottom there, include the OSHA report. Well, remember what I said earlier, what becomes recordable? Nothing that is outside the first aid. Anything that's outside of first aid, if it's lost time, they've been hospitalized, loss of consciousness, now we have this COVID. If they become a COVID claim that they prove that it was that the claim actually did happen in the job site, well, that becomes recordable. And this is what OSHA looks at. So all this information that's in there, if you did not hit that little bottom piece where it says include an OSHA report, it will just sit there in the CertiPay area. That's it. It won't go anywhere. But as soon as you click on there, then it transfers and exports all that good information that we just input, and it goes into your OSHA log. So always remember, garbage in is garbage out. That's why you need to go back and clean it and make sure it's updated. And then the next one is once you include your OSHA logs, you can run those, like I said, monthly. At the end of the year, you have your OSHA logs all in there. Nothing that you have to recreate. But again, every good information is important to have and update it. Don't just put nonsense on there. Be clear, specific, because if you were audited by OSHA, that's what the first thing they're going to want. Let's give me your 5 years of your OSHA logs. I hope everyone has 5 years of their OSHA logs. That is a OSHA regulation, and for every year that you don't have it, there's a violation. That violation can go from $600 to up to $13,000 for every year that you do not have it. And those violation fees went up. I believe it was like 2 years ago. They doubled them because a lot of employers were not complying by using the OSHA logs. So we have it in there. It makes your life so simple. Now, if it is a workers' comp claim, by Florida requirements, and it is a 7-day criteria, you could get a violation if you did not complete the OSHA log within the 7 days, and they will look at that because they will compare that to your loss runs. Remember, I asked for your loss runs now, and I'm going to compare it to your OSHA logs. And the first question I'm going to say, hey, why is this 15 days late? And was it because the employee did not advise you? That's different. But how do we change the mindset? Is by conducting daily reminders about how important safety is, that no matter how small the injury is, that they advise you on it, that you log it down, no matter how small that illness or injury you may think it's not. We're not doctors. I don't have an MD next to my name, so I can never tell you if anything is important or not. I just recommend to log it, just document everything. And if it becomes a workers' comp claim, that's what the carrier is going to ask you. Well, why was it after the 7 days? So important is the incident's work-related, is the incident a new case, and all of these things within that form has to be within the first 7 days. So again, it's just changing the mindset and reminding everyone to put on their safety hat on and doing your daily safety talks. If you have daily safety training, make sure that they sign off on it. So I didn't see any other questions. So I always ask, people always get the misconception that OSHA, OSHA, your workers' comp claim and your OSHA record keeping are two and the same. They're not. A recording does not prove it's an OSHA violation. It does not. A recording is saying, well, this miss, we'll talk about near misses. It's not a workers' comp claim, it's a near miss. Or that illness that occurred could have been from, sting bite, right? Or, spider or something like that. Did it get infected? Did they was there any lost time? No. Now, if they have lost their finger or something like that, then it becomes recordable. But don't assume because you recorded it in your OSHA log, it's a workers' comp claim. It does not. Now, if you were audited, they will look at your loss runs and your OSHA logs to see if they are comparable. Recording does not affect a person's entitlement to workers' compensation. Everything, as you know, you're working with good carriers out there. You have, your summits and your NCCIs and all those out there that they're looking to the interest of the employer, but always check with them first and let them know, especially with these COVID situations. I would say it's better to call them and talk about it than to sit on it and then if something happens, because they're there to help. This is a great, again, it's a gray area with these COVID cases. If a claim does open up as a COVID case, well, it could become recordable. But talk to your carrier about this. That's what they're there for. And look at, go and seek help and say, hey, I just had a COVID employee. This is what happened. We don't believe it happened in the workplace, but we kind of just want to give you heads up. So they know it's not going to affect your premiums. It's not going to affect, they just have it recorded. So in the event it does come back as a claim, well, it's already recorded. The rules, again, for Florida and all the other states are very different. So just comply with your Florida, workers' comp laws and your OSHA laws, and that's important. But always remember. So on the next one, what I was going to talk about a little bit is, do I have it? Yeah. Is almost finalized, almost finishing up, is keep the forms in file. Do not send any OSHA copies to anyone unless you've been subpoenaed, all right? Unless you're asked to do so and you're at high risk. So if you go to the OSHA, what's a high risk? Well, now we know. The nursing homes, the medical field, first responders, manufacturing, those are usually in a high risk. Construction, they fall under they don't fall under the general industry, so they fall a whole different area. However, do not send copies of your OSHA logs to just anyone. Make sure that those logs, your 5 years, are in there. Your employees are allowed to look at the logs, believe it or not. You have to allow access to them if they ask you. And if they're looking at their specific injury, if they had an injury, they have the right to look at their specific injury as well. If they want you to put that it's private, they can request that you do not place their name on there as well. So it's something to remember that they have the right to do so. And again, file and updates every 5 years. This is where everybody gets. Again, where I see all the violations, it's where those, no one has their logs. I go back and they're messy, or I can't even find them to begin with. So just, again, just keep them there for 5 years. And then once that year falls off, tie it and keep, and don't burn them. Don't do anything with it. Just keep them. And keep the workers' comp claims in a separate folder. I always like to use red. Red reminds me of alerts, medical, all of that. Do not place your workers' comp claims or your medical claims in the personnel file. Don't do that. Keep them separate. Those are important. And, and always remember, are you going to be prepared for me to come in and do your OSHA audit? Well, I'm going to be looking at a lot of different things. I'm going to be looking, doing a walkthrough. That's what we do. We do a full walkthrough. We look at every little detail, maps, everything, to make sure that you don't have any potential violations. And who's better to tell you if you do? It's better if it comes from one of us, from our HR team, than from OSHA, or someone that calls you out, an employee that calls you out and say, my employer is not safe conscious. My employer is not following the OSHA guidelines. And all of a sudden they call OSHA, they file a complaint, and who's knocking on your door? OSHA. The only agency that's allowed to come in without a subpoena is OSHA, believe it or not. The only one. The FBI can't even come in unless they have a subpoena, but OSHA could. They have more jurisdictions over coming onto your job site without letting you know. Now, don't get yourself caught off guard. Make sure that you have all these plans in place. So we're, I looked at the top violations, and I'm not going to bring all 10, but the 3 that struck, out for me was the hazmat communication. Anyone that has chemicals or working with chemicals, you must have that. The respiratory protection. If you're instructing your employees to wear masks in the workplace, they have to follow the respiratory protection guidelines and sign off on that. And of course, the PPE with the eye and the face mask. Those are really important that you follow those. Anyone in golf maintenance, machine guarding, those lockout, tagouts, you have to control those so nobody gets in there and turns a machine and cuts half their hand off. So those were the top 5 that stood out for me. There was a lot more, but most important during this COVID time, keep those logs in place. Make sure that you have those plans in place, and maintain safe awareness in the workplace. So I hope that you learned a little bit about this today, that I gave you a little bit of a window of what you need to be doing, that all of a sudden now May 26th hit, and we have these potential COVID cases, that if you have a COVID employee, now you have to log it down, and it has to meet all those criteria. And what does that mean? Now, I always tell you, call your carriers, talk to them. That's what they're there for. FCCI just added a new code for working remotely. Check with your broker. If you have anyone working remotely, check that you have the right codes in place. Check your workers' comp codes, that they are the right codes in payroll, because those do cost a lot of money if they're incorrect. And always seek the advice of your carriers if you have any questions about a claim, because they are there to help you. And most importantly, I guess, is every determine if an incident occurs, how do we document it? Is it recordable? If not, hey, we're here to help you. That's what our HR team is all about. We're here to help you. We're here to guide you. CertaPay has the system in place. It's been there forever. I hope hoping that my clients have been utilizing it. The OSHA system out of CertaPay, because it works. I love it. It makes your life so much easier. Don't think you have to recreate the wheel. So use it. And, post it by February 1st. Don't forget that. Don't let just any employee sign it. You, the GM, the controller, must sign and agree to that. So if you have any questions, we're here to help you. That's what we're all about. We love to talk to you more. So I'm passing it on now to Rachel. Thank you.
Rachel, we can't hear you.
I even keep myself muted. So thanks, Claire. Great information. Before we move on, let's see if we have any questions. Cindy, what do we have?
Okay, the first question was, what do you mean by recorded? Is there a form? But we've already answered that. Yes, it's the OSHA 300, 301, and 300A. Claire, can you tell them where to find that? I've got a few people wanting to know where they can locate those.
You're talking about in CertaPay?
No, ma'am. The actual forms, the OSHA forms.
Oh, the actual forms.
Yeah.
If you're not a CertaPay employee, well, you can go to the OSHA website, OSHA.gov, and you can pull the 300 forms out of there, and you can save it in your Excel. With your CertaPay employee, don't do that, because we already have it in there. You're just making more work for yourself.
Perfect.
Yeah.
Okay.
And just to kind of, before we go on, Cindy, just to kind of summarize these forms to make it easier to kind of understand, you've got your OSHA 301, and this is where you put individual incidents. So a situation happens, an injury, an incident, whatever, you put that on the 301. And then your log is a list of all of those incidents. And then your summary report is a summary of everything on your log. So each one kind of feeds to the next. So before you even put it on your 301, it needs to be one of those criteria where it requires more than first aid. So when Claire says, recordable and not recordable. If you just had to do a little first aid, somebody cut their finger and put a Band-Aid on it, it doesn't need to go on an OSHA incident report, but put it on a company incident report. So you're going to say, this situation happened, near miss, whatever. These are your own personal company incident reports of things that happen. And then once it crosses over to be a little bit more serious, now you're going to go to the OSHA Form 301. And then those forms are individual incidents where they were kicked up a notch from more than just first aid. And then at the end of the year, you're going to say, okay, here's my log. You're going to write all of those incidents down on your log, and then your information from your 300 log goes to your 300A. So they're all connected.
Correct.
Okay, the next question was, I have a company with 11 employees. Would it be necessary to report every incident? Well, Claire had already answered that. It's 10 and over, so to answer your question, yes. All right, Claire, here's one for you. What about an employee that is new, 1 year, and now he is complaining about back pain?
That's a typical one. You have to take all the information, use the incident forms. One of my favorite forms that I've been using for the longest time is actually was created by Summit. And it's very specific. It's 3 pages. The employee signs their section. The supervisor signs their section, and then there's a whole body part. Because remember, we have such a diversity amount of employees that may not speak English. So the whole body is, then they can just circle exactly when it happened. At the end of the day, you document it, you send it to your carrier, and let them do their work if they deny the claim because the employee, they can't prove that it happened at work. We're not yes, ma'am.
Would they not also need to go back and make sure that the individual might have a back brace available, making sure they have all the PPE equipment to avoid a back injury moving forward? OSHA does not recommend having back braces. So contrary to that old thinking, they feel that what it does is degenerates the lower lumbar area. Unless that employee wears it themselves and they bring it, that's different. But OSHA does not recommend to provide anyone with a back brace because that's actually become much more claims than anything else. If you're doing a post-medical questionnaire, you can always do a post-medical questionnaire, and that's something that you can use it. As a matter of fact, a lot of the workers' comp attorneys love post-medical questionnaires because after the employee's been hired, they're going to complete that form, and then that form stays in their medical file. It does not go in the personal file. So if a claim like that did happen, right, a year later, and the employee has filled out a post-medical questionnaire and never put in there that they had back problems, well, they can go back and do a search to see if they've ever had any injuries. And that person may have had 2 car, accidents prior to this. And then they probably will deny the claim. I'm not a carrier, so I can never talk, about how they will determine whether a claim is compensable or not, or whether they will deny it, or if it affects them. But the most important thing is having all the right tools in place. I like the post-medical questionnaires because it is used in many other workers' comp claims and lawsuits specifically, and make sure that the incident report is completed up to its, all the way out, not just filled out halfway, because when I'm pulling those workers' comp claims, I'm looking to see, did something stick out? And then let the carrier know, of course, too, that say, hey, this employee's been here for a year, never, ever complained. We have no documentation that they complained. But what if you did pull their file and back 3 months ago, you did find something? So that's why I think it's important that you capture all the information, take it serious. The ones that become a lawsuit are the ones that are not taken serious because at the end of the day, the employee has said, well, I told you about it, and you go back to the manager and it said, hey, this employee filed, said that they told you that they were having some back problems, and you know what I hear? I didn't think it was that important. Well, guess what? Now it just costs you a lawsuit. So take them serious.
all of those, document them, put it in a file. And if something comes up, and if you have a question, call your carrier.
Just
And
to
the
clarify,
other thing is, yeah, go ahead.
just to clarify, someone asked, yes, that would be your workers' comp insurance carrier. That's whom she is trying to address.
Yes,
Yes,
your workers' comp, insurance. Whether, like I said, or it could be NCCI or Summit or some of those, right?
And when we're talking about, like Claire said in one of the previous slides, you talk about a work comp situation and an OSHA recordable situation. They're not always the same thing. So in this example, somebody has back pains not connected to a situation that happened at work. We're not talking about an OSHA recordable thing, but it might be a compensable work comp claim from the work comp carrier. So that's something that would be an incident report or written down as a situation, and you're going to call the work comp carrier and report this claim that an individual has back pain. But it doesn't necessarily automatically mean it's OSHA recordable because it wasn't connected to work. If something specific happened at work where the employee fell or tripped over that pallet or whatever it was, if the employee actually hurt their back at work during a work situation, now it's both. So now you have a work comp claim and you have an OSHA recordable situation. So they don't always mean the same thing, like she said.
Right.
So it just has to be connected specifically to work.
Right. And that's really important. And something else I want to bring out is, say you do have someone that has back pain, well, don't let them keep doing the same job, because if you don't remove them from that position temporarily or give them restricted duties, we have other issues that can fall under the ADA. But if you let them continue, and they've already informed you, they've given you the heads up, hey, I have some back pain, and you don't take any action, and change, either modify their job or do something, then you just earn that claim because you aggravated the injury. Same situation, if someone's been out on a leave, non-work related, if they've been out on a leave, on a medical leave of absence because they had surgery, I've always advised to have a fitness for duty certification from their physician with a copy of their job description, because we don't want that injury to become aggravated in the workplace, because then it does become a workers' comp claim. So that fitness for duty certification is really important especially during this stage with COVID, that if someone's been out for a long time, you want to make sure that they're able to return back to work, or if their job needs to be modified temporarily or restricted light duty, that if you're able to do so. Don't aggravate the injury, a non-work-related injury, to become a work-related injury because you failed to request the proper forms. And a doctor's note saying I can return back to work, to me, it's useless.
Okay, I had some follow-up from the same individual asking the question. You might want to contact us offline. This seems to be a very specific situation, and I think it might be best if we just discuss it offline. I'll make sure that I have your email address, or you can give it to me, and I'll get it to Claire and let her answer your questions offline. Is that okay?
That's right, because, based on those questions, I'm seeing a potential ADA issue also. So
Correct.
Definitely reach out to us and let's see what we're dealing with there, and we'll help you out with that.
Okay, Ms. Claire, next question. Is COVID-19 coded as respiratory or all other illnesses?
All other illnesses.
Okay, next question. What if you do not have injuries to report?
That's what we're telling you today. OSHA can change it to next week. Remember, this is all new to everyone. This is so new. This in the beginning when we all started, our team just jumped on every law. Really dive into this. What May 26th suggestions that they have may change June 26th. So as of today, it's still all other illness.
Okay.
And you're not going to be docked for that if you did it wrong anyway. So I can guarantee that.
You're safe with that.
Yeah.
Next question. If you do not have injuries to report, what would you log?
Well, you always have to put your 300A, your summary every year, which is great. And your summary shows that you had no injuries, period. That's it. It is a requirement that you post it on February 1st. It has to be visible for everyone to see, all your employees. What I always suggest is to maybe just laminate it or put it in, in the break room, sign off. It goes up there from February 1st to April 31st, and then you take it down and you put in and actually insert that with that year's OSHA logs. Don't throw it away, because that's part of the audits that they look at too. But if you don't have any injuries, yay, that's perfect. Good for you.
Actually,
you still have to post it.
There's actually a lot of manufacturers that post that on a daily basis for team morale, that they've gone so many days without an accident and they earn lunch or whatever. It's a motivating factor to keep your team being safe.
Yep, good point.
Okay.
Good point, Cindy.
Next question. I have never logged into OSHA. Is it too late to begin? Never too late.
No, OSHA is a free site. It's a website. It has the most amazing amount of resources and tools. It has probably one of the best tools right now is the guidance for employers during this COVID pandemic. I've been advising every client to take that guideline, use it. It's a great tool. It has everything that you need right now. They've had this. They just changed it because they had this guideline already when SARS was out and all the other pandemics. So there's a lot of information. It's never too late to go in there. They're not going to track you by your IP address. Don't worry about that.
Okay, next question. Are public schools required to follow OSHA guidelines?
Everyone is required to follow OSHA guidelines. They're a separate classified industry. I talk mostly about the general industry, which is where I'm certified in, OSHA's general industry certification, and this applies to everyone outside of everyone except the medical field, first responders, hospitals. Who's the other one? Schools. Well, although I do have a client at the school, yes, and really that's it. But construction. I do deal with construction, but they have different OSHA guidelines. Each school has to follow their state mandated guidelines too. Each state has state mandated guidelines as well, in addition to the OSHA safety guidelines.
This is more of a comment than a question, Clara, but it's worth noting and letting you expound upon. We give our employees a pre-placement physical job description that they read and acknowledge that they are able to perform the job duties before we send them to our approved clinic for a pre-placement health screening. This avoids any surprises. What are your thoughts about that, Claire?
What kind of industry are they in?
That I do not know. Can you type in and tell me what kind of industry you're in?
If they're in the medical field, if they're in a nursing home, healthcare field, that's very different.
She wrote in construction, so that's right up your alley.
So construction. So you're using a post-medical? Is it post or pre?
No, it's a pre-placement physical job description. So they get the job description. They're acknowledging, they sign it that they can perform the job duties that's being asked of them. And then once they sign that, then they are sent to an approved clinic for a pre-placement health screening. So before they go for that physical, they're already telling her or him, that they can perform the job.
Yeah, I can't answer your question unless I saw that pre-screening form, because the ADA, the American Disabilities Act, does not like anyone to be using those type of forms unless you're in the healthcare and the medical field. Because you're in construction, my electrical clients, construction clients, you have to be really careful about what you're asking. It can get you in trouble. The only way we can advise is we saw that form and what questions you're asking. But technically, it's not something that we advise on if it has any medical questions in there. Post questionnaire, yes. And now the other thing too, if you're DOT, that's different.
I actually have no other questions in the chat box. If you would like to type something in, please do so. If not, please make sure you type in your emails. I know Rachel is going to move on to a few other things, but since I brought it up, if you all want to type your email addresses into the chat box, I will capture those to ensure you get the recording of the presentation today. Go ahead, Rachel.
On the slides. So thank you so much for joining us. And next week, we are planning to talk about the PPP loan forgiveness updates if we get them. So keep your eyes peeled for the invitation for our next coffee break. It'll either be on the forgiveness updates and the new form and whatnot, or if there's something special that you want to hear in a coffee break, put that in the chat for Cindy as well. And we'll put together some new topics for you guys as we move through these times. And once again, thank you so much. Certipay is here for you. We can tackle any of your issues and problems. We can create customized platforms that help you in whatever way you need. And thank you all for joining us. Thanks, Claire. Great job on the OSHA update. We appreciate all of you. Everybody have a great day.
Don't forget, put your safety hat back on. Keep everything safe.
Enjoy your coffee, too.